Hi, this is Georgina. We're going to be talking about the week 2 and 4. It's important that you do it this way because you don't want it to do it one day and the next day. It's not going to work. You need to go ahead and do everything at least 2 weeks. 2 weeks period enough for you to work and to make something, the outcome be something positive for you. All right. Otherwise, you're not going to have any good side effects, kind of. All right. So we're going to be asking you a few questions, and this is when you're going to know if you need what kind of detox you need, because it's different kind of chemicals that you're going to get exposed, chemicals in the food and the environment and the air, but all of them, they affect you different, including some mold, like fungi and stuff like that. They also can affect you. So we're going to go over some questions, okay? We're going to be talking about the mood questions at the beginning. And when we go to the next one, I'm going to tell you. In the past 3 months, how often have you find it hard to feel wide awake within 30 minutes of rising? When you get up, I know that when you get up, you don't get up and jump out of the bed, but if you are 30 minutes and you're still like a little sleepy, that's not right, all right? So you put it in there. They need some stimuli like coffee, tea, something sweet, or cigarette to help you to keep it in the morning. And a lot of people say if I don't drink coffee, I don't function. Feel tired or sluggish after the meal during the day. Like a lot of people when they eat, they feel really tired or want to fall asleep. Crave something sweet or stimulant after eating a meal. Feel irritable or faint. It going 6 hours without eating something. This is one of the main side effects of hypoglycemia. When you're already mad, when you're hungry, you have certain length of hours without eating and you start feeling hungry and you start getting really mad, is a bad sign. It's also to the sugar, your insulin is not working properly anymore. Had a hard time concentrating or experience mood swings. Like sometimes people, they have those ups and downs. Crave sweets, foods, desserts, chocolate, bread, biscuits, cereal, or pasta. Had added sugar in your drink and added sugars or sugar substitute. Use often has sauce, gravy, and other foods with high sugar. Like a lot of people, they think the sugar substitute like Splenda, like stevia, or like all those things that they are so processed and stuff. Stevia is a plant, but they process it now a lot too. So, when blue agave and all those things that they say that they're supposed to be healthy, you add it sometimes. It's true that they don't have no calories, but it has a lot of other stuff that they can affect you, a lot of chemicals that they can toxify your body big time, okay? Consume certain foods to prevent anxiety, help you relax, or help you to cope with a stress situation. Like some people say, if I eat bread, I feel better, when I'm stressed out. Or I get some chocolate, or I eat some whatever they think, or a popsicle or something. I heard a lot of stuff that you're awkward, but a lot of people when they're anxious or they are under a lot of stress, they crave for certain food, like salty food also is another one. Feel depressed, exhausted, or too tired to move your body or do physical activity. Gastrointestinal assessment. Now we're going to go with the GI tract. A lot of people think they just detox has something to do with the GI tract, but also it has the move, it affects all over the body. That GI assessment. Take antacids or ingestion tablets or drops. When you eat, a lot of people, they have to take something else in order for them to feel better. All right, feel indigestion or burning sensation in your stomach. Feel a stomach discomfort or an uncomfortable feeling of fullness of 5 hours after eating. Feel pain or difficulty to digest fatty food or oily foods. A lot of people have difficulty to digest, especially heavy foods, okay? This is what is the question about. Feel bloated, stomach, or pain from eating certain foods. Suffering from constipation. All right. Constipation is very, very, very common in a lot of people. What is constipation? Okay, if you eat every day, you're supposed to poop every day. If you go more than a day without pooping, like 2 days, 3 days, and I heard that a lot in my clinic, that's constipation already, okay? You don't need to be like a week or something like that. But if you regular poop every 2 days, that's not normal. You got to poop every single day. You got to go to, evacuate your bowels every single day. All right? And sometimes twice, 3 times a day is normal. Now, if you poop too much, it's not normal, especially when it's watery, like diarrhea, because you can dehydrate, okay? Feel nauseous after eating and suffering from vomiting. Burp, hiccup, or pass wind a lot. Felt to have a bowel movement at least once a day. Now we're going to go to the toxicity assessment. Has sinus issues or runny nose, stuffy nose, or excessive mucus. Had acne spots, cold sores, athlete's foot, skin rashes of hives. Had blocked or itchy ears, pain or ringing in your ears, ear infection or ear discharge, pus, ear wax, fluid, blood from the ear. Now, one of the things is the ear. You have something smelly or pus or earwax, it's okay. It's an infection, okay? But also, too, one of the patients that I got before, it has some clear water coming out of your ear. If you have some clear water coming out of your ear, you have to go to the emergency room. Even this sounds so stupid what I'm saying, but it means something to do with your brain. So please don't confuse the pus, earwax, fluid. Fluid like a water with pus, and sometimes it stinks. It smells really bad. Or, bloody ear, stuff, that's more infection. But if you see clear water from your ear, you gotta go to the emergency room. That has something to do with the brain, like I say. So I just wanted to put it in there because sometimes things like that, people don't pay attention to it. Had watery or itchy eyes, swallowing, red or stinky eyes, or dark circles on the bags under the eyes. The bags under the eyes are very common. Had suffered from bad breath, suffering from foul body odor, including your armpits or your feet. Not being able to tolerate coffee or caffeine, or feel unwell after having coffee or caffeine. Some people feel sick after drinking coffee or, caffeine drinks. Not being able to tolerate very small amount of alcohol or feel hangover the next day. Found it hard to lose weight or suffering from a sluggish metabolism. Inflammation assessment. This is another area that it can also mean you are very toxic. Take painkillers or anti-inflammatory medication. Suffering from allergic reaction or have fever. Have pains or aches in your body or muscle. Suffer from bloating or water retention. Suffer from irritable bowel syndrome. Suffering from dermatitis, eczema, rashes or itches. Suffer from shortness of breath or asthma. Suffering from colitis, colon inflammation, Crohn's disease or diverticulitis. Suffer from headaches or migraines. Suffer from other aches, pains, infection, or inflammation symptoms. I wanted to see if you can add it up, all the stuff, to see how toxic you are. From 1 to 5, the 1 means it's not often, like once a week, and 5 being a lot, like more than 3 times a week, something like that. And you get your score, and then from that point on, we're going to know how toxic you are. So we're going to go over that, and then when you're done with it, please keep your records. That way we can go ahead and have it ready for the next class, for the next video, okay? All right. Thank you.